Akhaltsikhe. I'm a Peace Corps volunteer and I work in Akhaltsikhe, Georgia, and I'm going to show you the medical clinic that's on the first floor of my non-governmental organization. Our women's health clinic is on the first floor of the offices of Democrat Women's Organization. There's also a girls' organization called Women's Hope housed here, as well as the American Corner, which is an American embassy-funded English library. But for today, we're only going to talk about the first floor of the medical clinic. So this is where women come to wait to be seen. We decided to do this interview or this tour early because a lot of women don't want to be filmed coming here. There's kind of some negative connotations about being seen for pelvic exams and contraception and mammograms, even though it completely makes sense. Some women are still really shy about it. So there's no patients here right now, and we are doing that on purpose. We're really excited about our mammogram machine because it's the only one in the entire region. It is from year 1991, which is really new for this part of the world, and it was given to us by an American donor. So we have a mammogram technician, Maiko, that handles all of our mammogram appointments, and so this is where she is when she has patients, but when she doesn't have patients, she goes across the hall because it's warm, and here there's no heat. So we do have some electricity issues with this machine because it does require so much electricity, so sometimes we all have to turn off our computers or turn off our heaters because we need to run the mammogram machine. But it's a great resource for women in this area because there are no other options for mammograms, and the best thing is that our mammogram services are free. So we are funded through the National Screening Center, which is a Georgia government organization. This is the main room of our medical clinic, and I'll introduce you to the three medical professionals we have here today. This is Dr. Manana. Dr. Manana is our gynecologist, excuse me. Should I introduce yourself?
მე ვარ მანანა გენგჟანოვიჩი, დემოკრატ ხალხთა საზოგადოების გინეკოლოგიური კაბინეტის მთავარი ექიმი და ექიმი მიან გინეკოლოგი.
So this is our table that we use to give pelvic exams. Dr. Manana also provides an array of gynecological services, and I think really importantly, she provides contraception. Which is something that we don't advertise much because of the conservative nature of Georgian society, but we do offer that, and I think a lot of women, if they don't know about it at first, they sometimes leave knowing about it, which is a really great thing. So again, all of our services here, including the pelvic exams, the gynecological services, the contraception, all free, which is unheard of in Georgia. Dr. Manana was showing us her sonogram machine before, which is apparently very expensive. It's about 1,500 lari, which I think we recently got. So she's able to see some pregnant women as well for free here, which is a great service to offer. This is Sito, who is our laboratory technician. Sito, you want to introduce yourself?
გამარჯობათ, მე ვარ ციცო ლომიძე, ვმუშაობ დემოკრატ ხალხთა საზოგადოებაში ექიმ ლაბორანტად, დამთავრებული მაქვს ბიოქიმიური.
So she's our laboratory technician. You can see we have some rather old equipment that we use to test and do samples, and part of this project would fund new equipment for Sito to use. So I'll show you the other room that Sito uses, which is at the other end of the clinic. This is Sito's room, and again, she doesn't use it as much in the winter because this is colder in here, but you can see we have a lot of her equipment, her medical bowls, and I don't know exactly what it is, but it's all Sito's stuff. And again, this grant would help us get more equipment for Sito. Right, this is Maika, who is our mammogram technician, and we've brought her on in the last year since we got the mammogram machine. So, Maika, I'll let you introduce yourself.
გამარჯობათ, მე ვარ მაია მამულაშვილი, მამოგრაფიის რადიოლოგი. მუშაობ ქალთა დემოკრატ საზოგადოების კავშირში.
Most of the time, again, when she sees patients, she's across the hall, but again, it's warm in here, and we don't have any patients yet because it's still early. So now that you've seen a little bit of our clinic, you can see what our working conditions are like. I think that we do a lot of good here. I think they do the best they can with what they have. but everyone here knows that with a few slight upgrades in equipment and materials, they can see a lot more women. And by a lot more, I mean up to 40% more women every month. So what we would hope to buy with the money from this project is a new special, it's called a multifunction table, which would allow us to process our mammogram films quicker. And we also would want a light box so we could read our own mammogram films, which would mean that our time waiting for results would go from a month down to 10 days, so we could do it a lot faster. For CITSO, the laboratory technician, we'd like to get her some new slides, some new slide covers, and just generally some new equipment, new needles, new syringes. And we also want to get them, it's called an autoclave, it's a sterilizer, which would allow us to see a lot more patients because they would spend less time sterilizing equipment and they could get more people through the door. And I can tell you that every dollar that you donate to this project will be put to good use. There won't be any waste. We have it down to the dollar of what we need to make this clinic a lot better. So I personally would appreciate your support, as would everyone in this office, and you would be doing a lot of good for a small minority region in the middle of Georgia. Thank you.